People are talking about in the newspapers, unnecessary stents are being placed in blood vessels during, cardiac or coronary, for coronary conditions, etc. That are, you don't really need to do it. Do you? Don't you? What's going on?
All right. Well, it's a great question, and it is in the paper and in the press, and people are always concerned, are doctors doing unnecessary procedures on patients? Before I answer that, if I can, let's just give some basics so people understand what's going on.
Take it away.
Your heart's a muscle. It pumps blood around the body. All the tissues and organs in your body need blood. In order for every part of your body to work, it needs blood. That's the gasoline, if you will, of the body. Mm-hmm. And the way that gets around is via your heart. Your heart pumps that blood around. But although the heart is a pump, it needs to get its own supply of blood. And it gets it via coronary arteries. And there are 3 coronary arteries. And the way you could look at a coronary artery is it's sort of like a garden hose bringing water to a lawn. Mm-hmm. If you have a kink in that hose by the faucet, your whole lawn doesn't get watered.
Correct.
And if it's out by the fence, it's a little patch of grass. So where you have a blockage in a coronary artery determines how important the blockage is. But once you have a blockage in an artery that limits flow, it's going to cause symptoms. We always call those symptoms angina. Angina is just a word to describe a symptom that you feel when you have a blockage in an artery. Mm-hmm. When you have a blockage in an artery, that's where the controversy with stents comes in. If you have a blockage in an artery, if you don't fix that blockage at a certain point, that artery can close, and that's what a heart attack is.
Close, or it becomes obstructed?
Same thing.
Okay.
Obstruction and closure. Usually it's a combination of things. You have a cholesterol plaque with calcium, a blood clot forms that shuts off the flow. And just like that garden hose, if no water got to that lawn, you get a brown lawn. If no blood gets distal or past the obstruction or closure or stenosis, the muscle dies, and that's a heart attack. So angina is the warning or the symptoms leading to let one know that you have a problem. Mm-hmm. And a heart attack is when the artery closes. And once that damage is done, heart attack is dead heart muscle, you can't fix that damage. That's permanent. The heart can't regenerate. So our job is to diagnose when someone's symptoms are related to the heart. If you have a blockage, determine, do you need medication, do you need a stent, or do you need a bypass? And there are different ways to assess that. The controversy now is, well, we make these diagnoses of blockages. Do we necessarily need to put a stent in every person who has a blockage? Mm-hmm. And in any area of medicine or law or business, there are some people who do things appropriately and some people who don't. So I'm sure stents are sometimes going into patients who potentially don't need them because the doctor is putting them in for financial reasons, which the paper might imply. Mm-hmm. But I think most of the times that doctors are going to be pretty ethical about it, and that doesn't mean that a stent's not going in necessarily. What I mean by that is, when you're taking care of a patient, you need to determine what's best for that patient. But, you know, you're not God. And sometimes you say, I see a blockage and I think it's going to be right to put a stent in. And sometimes you see that same blockage and say, I'll try medication. If you knew in advance which way was the best way, then that would be perfect.
You don't.
But sometimes you say, well, the blockage is not critical, I'm going to treat with medicine, and the patient has a heart attack. You'd feel pretty bad if you didn't put a stent in. And if you put a stent in and then you have a problem with the stent, then you say, gee, why didn't I treat with medicine?
Damned if you do, and if it doesn't matter what you do.
So, you know, I'm sure there's some validity to excessive stents going into patients, but by and large, I think most doctors are doing it appropriately. And in fact, at St. Francis, as well as other hospitals on Long Island, to address that issue, we have certain criteria that we use for all our physicians after the procedure, and we check to see that the criteria that they're using is appropriate. So not only do we check it on a monthly basis in our conferences, but on a quarterly basis we have a quality assurance committee review statistics and criteria that our doctors use to put stents in.